Raf TV is the best. Raf himself is the best. Yeah. So I have with me here the vice president for this noble institution. Hello, what's your name?
My name is Sylvia Pinamayefi,
Sylvia. I'll call you Sylvia. A student midwife or a student nurse?
a student midwife.
A student midwife. Okay. So what really inspired you to take up this nursing journey?
Okay, I was inspired by my career goals. That is, I have passion to help other people and to make sure that the needs of the sick and both the role are well taken care of. So I was inspired to come and learn more about it so that I can make sure I expand it and make it beneficial to everybody.
Alright, so since you started this journey, what has been the most rewarding part of your education so far?
Okay, so the most rewarding part is, aside for the fact that we've learned a lot, it has also helped us in leadership roles, giving us opportunities to lead and also help us to help others. When we go to the world, we get the opportunity to meet individuals, help them, and make sure all their needs are met, just as I had the opportunity to do it. Yeah.
So what has been the challenging aspect as well? From level 100 to level 300, what has been the challenging aspect for this journey?
Okay, it hasn't been easy at all. Just as life, we have back and forth. Yeah, so the learning aspect, monetary aspects, financial aspects, and everything, it hasn't been easy. But by God's grace, we are managing. We are able to manage our class activities with our clinical activities, and everything has gone on so well. So by God's grace, we are in level 300 and we are about completing.
All right, thank you very much, Vice President Sylvia. Right. So be wrapping up. What is your last message to anyone watching RAF TV?
Okay, so I'll motivate others who want to join the nursing to come. They shouldn't be demotivated by anything others are saying. Just know what your heart desires, and then I'll also use this platform to tell everybody to keep watching RAF TV and support you with everything we have.
All right, Sylvia, thank you so much. Do you have any social media handle? TikTok, Snapchat? You don't have any?
No.
All right, thank you for having me here. See you later. Alright, so hello everyone. I have with me here this beautiful lady from GOASO NMTC. I'm here to have a chat with her about her nursing journey since she started. So, good afternoon, beautiful lady.
Good afternoon.
How are you?
I'm good, and you?
I'm also fine.
Okay.
Alright, come closer, come closer. So, since you started this nursing journey, what has been the most rewarding part of your journey?
Okay, thank you. Nursing is very challenging, and because of its challenging level, it has really developed my critical thinking ability as well as being, empathy to people, empathetic to people.
Okay, empathetic. And what really inspired you to take up this nursing journey? Nursing is a lot of work and it demands, determination. So, what really inspired you?
Oh, okay. I'm really drawn in making positive impact on people's life when it comes to health aspects.
So that inspired you to take up.
Sure, yeah.
All right. So since you started this journey, what are some of the challenges you've encountered so far? From level 100 up to level 300, what has been some of the challenges?
The challenges really lies at the world side, the health facilities. You see, health is about giving life to people, especially I'm a midwife by profession. Okay. And receiving life and losing life is really a challenge to me because I can't stand to see patients dying and their relative will be asking what happened and how is my spouse, knowing well that the spouse is dead and gone. Yeah, that's really challenging and really overwhelming.
All right, thank you for that. And so what are some of the advices you give to somebody, probably the younger ones who would like to take up this nursing journey?
Okay, what advice I will give to individual out there is nursing is good, right? Okay. Because you get to be educated by yourself. It will help your family as a whole. You see, you get to learn more about health and other related matters that will help you as an individual to build yourself as well as the nation as a whole.
All right. So before you go, what's your name? I forgot to ask. What's your name?
Nkrumah Aframa Roda.
Nkrumah Aframa Roda.
Yeah.
Do you have any social media handle like TikTok?
Yes, I have TikTok.
Can you put your handle out? Probably someone would like to follow you.
Roda. That's my
Roda.
yes.
Spell it.
RHODA. Roda. DA.
Alright, so we'll be wrapping up. What is your last message to anyone watching RAF TV?
Okay, so my last message for anyone watching RAF TV is we are welcoming you all to our SLC week celebration as well as the 15th,
Anniversary.
anniversary.
Okay.
Yes, we have exciting programs that will be going on, exciting activities such as dinner nights, awards nights, the lobby nights, a whole lot of packages that we have for you.
All right, Rhoda. Thank you for having me here on RAF TV, and hope to see you again. Bye.
Bye.
Good afternoon, pretty lady. How are you?
I'm fine, and you?
I'm also fine. Talk louder. What's your name?
I'm Addison Kukwa Manuela.
Addison, come closer. Come closer. So what really inspired you to take up this nursing journey?
Okay, thank you for the question. Actually, what inspired me was based on the differences I'll make in others pertaining their health and other personal to myself, to personally to myself and my family and other people's family as well. So I just want to what nature them and what help them based on their health, so that it wouldn't be a way that so many crises, health crises will be so occurring severely in the country as a whole.
All right, thank you very much. So since you started this journey, what has been the most rewarding part of your journey so far? From first year, I can see you're in third year, right?
Yes, yes.
From first year up to third year, what has been the most rewarding part of your journey so far?
Okay. So the rewarding part is amazing for me, an aspect where I've been able to acquire a lot of knowledge based on health issues, and which is going to help my families and other people's family. And also I've acquired a lot personally in aspects where I can able to nature myself irrespective of my families being around or not around. I can able to what nature myself healthy, stay healthy, and other make sure other people too are also healthy.
All right, thank you very much. And lastly, before you go, since you started this journey, what has been the most challenging aspect as well?
Oh wow! So the most challenging aspect, something I don't want to disclose it, but I have to since you asked me.
Yeah.
Okay, so the most challenging aspect was when it comes to the academic side. I'll talk about the academic rigor, and where there's a long hours of studies, and also most times we are being called impromptu, and we find like
To be Russian?
yeah we are in a haste to get to do our things academically, and also the environment as well, it looks so stressful. Everything is so stressful since first year to now. It's kind of fair, but you've been able to cope. Yeah, and also the clinical aspect when we get to the ward, sometimes it's almost compared to the same thing as we were trained in class. The same thing, the stressful activities, long and irregular schedules for work, like how you want your work to be. That's not how they're going to plan for you. Sometimes you've been called to come for afternoon shift, but maybe you might have other things to do in the afternoon. But you have to ignore your own and come to work. That's sometimes challenging.
Thank you so much for that. We'll be wrapping up. What are your last messages to anyone watching RAF TV?
All right. So my last messages to everyone out there, or everyone out there, is especially those who want to pursue or be like me here. I'll just tell them to have the spirit of perseverance, and what they should stick to their plans. They should stick to whatever they want to become. They shouldn't have a change of mind that this is what my colleague is saying, so I wouldn't pursue what I have my vision is. I wouldn't pursue it. No, just stick to it. Have the spirit of perseverance, and you're going to acquire successfully.
All right, thank you very much for having me here. Come here. Do you have any social media handle like TikTok, Snapchat?
Yes, yes, I'll say Snapchat.
What's your handle?
Um, ma underscore Noella.
My underscore Rella.
Noella.
Noella.
Yes.
All right, thank you for having me on RAF TV. Hope to see you again. Bye bye. Hello, good afternoon, pretty lady.
Good afternoon.
What's your name?
Bachua Justicia,
Boashua Justicia, a student nurse or midwife?
a student midwife.
All right, come closer, come closer. Justicia, right? So, what really inspired you to, take up this nursing journey?
Nursing has been my dream since I was a kid, and I'm really thankful to God for making my dream a reality.
All right, we thank God for making this dream a reality. So, since you started this nursing journey, what has been the most rewarding part of your education so far?
Well, it hasn't been easy through first year, second year, and third year. Well, the most rewarding part is the practical aspect. We're welcoming someone into the human part. It's not easy, and it's really the most beautiful part of it all. Yeah, that's my reward.
All right. So since you started this nursing journey, what has been the most challenging aspect as well?
Well, sometimes I feel like quitting because learning is so stressful, to be honest with you. But sometimes I'm motivated to learn hard because my colleagues are moving forward, and I also want to try and make it as others have always done and have tried to make it in life.
All right. So quitting is never an option. So what advice will you give to the younger ones who have the dream and the passion to become midwife or nurse in some few years or some few months to come?
Well, I'd advise them to come and join the nursing community because it's a very good experience and beautiful one as well. They shouldn't let anyone discourage them outside there that nursing is not good for them or nursing is hard for them.
All right, Justicia, thank you very much. We'll be wrapping up. Do you have any social media handle?
No.
No. TikTok, Snapchat, TikTok. What's your handle?
Boachua Justicia, that's my name over there.
Boachua Justicia. Okay. So Boachua Justicia, thank you very much for having me on RAF But before we go, what is your last message that you tell anyone watching RAF TV?
Okay, to everyone watching RAF TV, I say you are very blessed to watch this television because they are the best and they always give us the best experience. Thank you.
All right, thank you very much. If today is your first time, don't forget to subscribe, like, and share. All right, thank you for having me here.
Thank you.
See you again.